Dr. Juliet Clayton is a neurosurgeon. Dr. Clayton was Claire's surgeon on 2 occasions. Dr. Clayton operated on Claire to debulk a cerebellar tumor. Prior to operating, she checked the diagnosis with Tom Robertson, the neuropathologist, who confirmed the tumor to be a medulloblastoma. Dr. Clayton made a file entry to that effect. A week earlier, a biopsy had produced tissue that Dr. Robertson had examined. Although he had asked for a second opinion in regard of some iffy cells, Robertson was nonetheless confident enough to confirm a diagnosis for surgical purposes. Some time after the surgery, we had a follow-up appointment with Dr. Clayton. The following exchange occurred as she met us, and, as I recall, even before we entered her office. Hello, Dr. Clayton.
Hello, Mr. O'Lear.
Did you know about the change in diagnosis?
Yes.
How often does a diagnosis change in such a significant way?
Never. It just doesn't happen.
I don't recall asking Dr. Clayton how the diagnosis changed, or why, or who changed it, or maybe I did and she claimed not to know. At the time, Lynette and I didn't understand what was happening or the real implications that the diagnostic change had, but Dr. Clayton did not vacillate. When the question was asked, she answered immediately and openly. She expressed shock. If extreme diagnostic changes never happen, why did it happen in Claire's case? The Office of the Health Ombudsman has ignored what Dr. Clayton said. Its expert opinion provider also ignored what she said. The Office of the Queensland Ombudsman has refused to look at what she said, or indeed, to look at the issue, and yet has informed itself sufficiently to tell me that OHO's decision-making was perfectly appropriate. The coroner ignored what Dr. Clayton said about the diagnostic change, failed to consider the implications, but stated that there was nothing suspicious about the circumstances of Claire's death. That's a huge call, in circumstances where the coroner has refused to look at the little clues that something was seriously wrong with the picture. The change in diagnosis changed everything. Our daughter is dead because of this inexplicable change that nobody is willing to take ownership of, yet not a single investigatory body or watchdog agency wants to know about it. You have to wonder why, eh?